Bald Truth Dental Politics Podcast News Alert. Brought to you by Digapalooza, continuing education event. More info at dentistryingeneral.com.
It still begs the question of, is the hand skill exam something that dentists should have or not have? We don't want to do away with it just because there's a fee for it. The question, is it a valid exam? Should there be an exam?
I think it's a great question. Is it important that you can demonstrate that you can actually do what you have the knowledge to do? So there are three things you have to test in a high-stakes licensing exam: knowledge, skills, and judgment. And you have to test all three of those, not just one of those. My guess, if Stephen Hawking were a dentist, he would be able to pass any written exam that they could present him, but he could not do dentistry. We have a longitudinal look how many dentists are not successful. It's about 0.5% to 1.5%, depending on the year, which is similar to what other licensure exams test. Is it important when you take your pilot's test that you not only pass the written test, but can fly the airplane? There's a reason they sit you in that seat and say, show me what you can do. People who cannot do a relatively straightforward class 2 and class 3, or cut 3 of the prosthetic preps, or do the endodontic portion, speaks for itself. Why can't you do that on a standardized platform? On retakes, absent remediation, do we see declining performance? In other words, if I take a cohort of people who failed the exam, test them again, their pass rate goes up, they're more successful, then it was almost a random decision. That's not what we see. On subsequent retakes, performance keeps deteriorating, and after about the third retake, they never pass it. They're just unable to do it. So I would ask any dentist, do you find it significant that someone cannot do a class 2 on a simulated tooth in a mannequin on a patient that doesn't move, doesn't need anesthesia, can hold their mouth open all day long? Is that significant? To me, as an oral surgeon, when someone can't do something, it speaks for itself. And the argument that good hands have bad days just isn't true, because really when you say that, what you're saying is there is justification for doing clinically unacceptable work on any given day. I haven't seen that yet. And I don't know a patient that wants to hear, the rest of my work was great. I'm sorry what happened to you, but every other patient did well. Really, it defies logic. We as clinicians understand, ask any dentist, did you get better over 5 to 10 years of practice? I got dramatically better. I think every dentist. So I've been in these debates with the Division of Testing of the ADA where their spokesperson says the brain tells your hands what to do. And I said, I wish I knew that. I would have been in the library a lot longer so I could play golf better. But that doesn't work that way. I'm going to give you an example of someone who knows all about this exam, could pass any written component of it, and would fail the performance exam. Me. I'm an oral surgeon. I haven't done these things since 1978. I know about caries. I know about preparation principles. I know how to grade the preps. I know about prosthetic principles. I can't do it, though. I do not have the hand skills to do it. And I think it is important for patients to know that I do, at least at one moment in time. We're a surgical discipline. We are primarily a surgical discipline. Physicians in hospitals have to be board certified if they're going to be Joint Commission accredited, and they have to recertify. But every single case they bring in has to be reviewed for outcomes. It's a test every time. And you're right, we don't want students who have an incredible amount of burden, and that's certainly not the test, because I don't care what exam you talk about, the national boards, the DL-OSCE, or a performance exam, each of them are about $2,000. That's a fraction of what they pay for their dental education. We're not contributing to the debt. But even with that, we don't want to overburden them with unnecessary fees. Actually, the costs are quite reasonable if you compare it with other licensure exams. So it's not extraordinary. In fact, the 5-part ADEX exam covering all of those disciplines, including a computerized OSCE, is about the same cost as just the OSCE by itself from other sources. So the cost is really not increased, but I think protection for patients is increased. And I think all of us want to know the people who treat us, not just in dentistry, can do what they say they can do. Like I said, pilots have to do it. EMTs have to do it. People whose job it is to actually perform, not just didactically understand, have tests. And I know they're going to say medicine doesn't have these. They do, though. They have board certification, which is required. They have peer review of all the cases and admissions in the hospital. I was in the hospital 3 days a week. It was, and it should be. It's a test every time I treat a patient. And somebody reviewing it is not a bad thing. But we don't have that in dentistry. We just have a one-time look.
For more conversations, visit dentistryingeneral.com.